So I'm making this video to uncover the mystery of dentistry and why is it so expensive. So quick background on myself, 30 some odd years old. I've had a lot of dental work done, close to about 10 grand in dental work over the years. Everything from cleanings to root canals to crowns to bridges to crown lengthenings. A lot of work and a lot of expense out of pocket. Some of these tips here I'm going to pass along are going to hopefully save you hundreds if not thousands of dollars. Again, was a patient of all these different dentists over the years, and I found a lot of gray area and a lot of, you know, secrecy, as you might say, among the insurance agencies that provide dentistry. So, first off, choosing your insurance is going to be an issue initially, unless you were given insurance by your employer. If you're self-employed, then you'll probably end up needing to choose a PPO or an HMO. Quick little note on that. As far as PPO and HMOs go, from what I've found, if you need some urgent kind of dental work, if you have some real tooth pain, or you know you have a cavity and it's keeping you up at night, that sort of thing, you're probably going to be forced into a PPO plan, simply because that plan can be initiated the most quickly, within about a week or so, and that plan will be up and running. You'll be able to utilize it. As far as the HMOs go, from what I understand about that, you need to be part of a group of some sort in order to be able to get into an HMO, or you'll be paying on the front end, then you'll have to wait 3 to 6 months, something to that effect, before it even kicks in and starts working. As far as dollars for dollars, it just depends on how much work you need done and what type of work you need done will differentiate the pricing between the two, which is cheaper. Now, within those subcategories, in the PPO category, for example, there are different types of plans you can choose on the PPO plan. But again, you kind of have to know what it is you're going to need to have done, and you want to overestimate on what potential work you'll need to have done, as they always tend to find more problems once you're at the dentist, of course. How it boils down, quick little summation here, I've kind of figured out there. All your teeth have teeth numbers. That's how the dentists reference them. And each tooth number has different types of work that can be done on it, from drilling to crowns to you name it. So all of those procedures reference back to the industry numbers, which are kind of like dental procedure numbers, you might say. So for example, a tooth needs your front tooth, which you might think of as your canine tooth, is actually they call it, they're different numbers, so let's call it the number 6 tooth. Might need a crown, or it might need a root canal, whatever it is. And the reference by numbers, one of them, for example, is called D2340, and there's a whole list provided by the insurance carriers on what these numbers are and how much these numbers cost in network versus out of network, meaning, well, we'll get to that. So you have to kind of figure all that on the front end, what kind of work you need on which teeth, and then choose your dental, say PPO plan based on what that is, because they'll offer several different plans at different price ranges, more on the front end, less on the back end, but more on the work done. You have to look into that, and you basically have to become a dental insurance adjuster to kind of figure it all out to try to save yourself money here. They're not going to be too helpful in giving you information on which plan is going to be financially best for you, because that doesn't behoove them to do that, and it doesn't, line their pockets the best way. So you're going to have to figure that out. You're going to have to get the chart out, and you're going to have to figure out which teeth you have issues with, and figure it out how much it's going to cost out of plan. So that being said, choosing a dentist. That's going to be an issue as well, simply because there is no independent sources that are going to rate dentists on quality of work, on whether they're honest and direct with you on the type of work you need done, that sort of thing. So the best route I found was to go to Yelp and look up dentists that way, and then reference them back to find out if they're part of your insurance carrier plan. Best way I found to do is find 5 or 6 dentists, get their phone numbers, again, all from Yelp, reading some positive reviews hopefully, and get their phone numbers, then call them up and ask them if they are covered under whichever insurance carrier you have. And even above and beyond that, and this is one of the most critical issues, is if they do all the work in-house, meaning not just cleaning and a checkup, but also find out if they have an in-house, what's called a periodontist or an endodontist or surgeons or implant specialists, that sort of thing. Again, based on the type of work you need done, you want to have all this done in-house, in network, to be able to save yourself money. And make sure, this is critical again, make sure that they're employed by the dental office and not just set up as consultants, as it were, as that will cost you more money because that is considered out of network, and you'll sometimes pay double and maybe even triple the price if they are out of network. So some work you may need done that may cost $200 with under, that's covered under your dental insurance, in-house kind of work, may double that price to $400 if it's done by what's called a specialist or out-of-network service. Basically, that means all of the money that's being paid for the work is coming out of your pocket, not covered at all by the insurance carrier. So that's going to be a huge issue, and that you'll have to call around and just verify on each location that they do cover those types of work. Then you can concern yourself with, how the office looks, how the staff is towards you, the scheduling, that sort of thing. That's kind of secondary as far as I'm concerned, through my experiences with multiple different dentists over the years. So anyway, those are the basics. As far as getting work done on site, what you have to really be careful is, I found a lot of shady dentists over the years. They'll try to upsell you on rinses and that sort of thing that are not necessary. It's kind of a big upsell. I'm not sure if they make commission on the work or how they generate revenue, but just to give you an idea, dentists in the LA County area, in the Los Angeles County area, can make anywhere from $150,000 on up to $200 and some odd thousand dollars, depending on their specialty and where they work, basically. So it's a very profitable industry. That is why, in my case, for example, I see dentists on every corner. It seems like it's a very profitable industry to get in. Yes, there is a lot of education behind it, depending on what dentist you go to, which might also be an issue for you too. You want to make sure your dentist is educated, has been to college, ideally in the States, hopefully, if that matters to you. It does to me. I like to see a real educated dentist, but I like to keep my costs low at the same time. I want someone that, specializes in what they do and that sort of thing. But hopefully all of this can save you some money, because it has definitely cost me a lot of money to learn all these lessons along the way, and I wish you luck. And if you like this video, just let me know, and I'll record others on different topics that I know that I've spent a lot of money learning about over the years. So again, let me know if you like this. I appreciate it. Hit like and make a comment or send me an email. Thanks a lot, and happy dentistry.